very good to see so many of you and many familiar faces. You're all very welcome. So this is a webinar of the Global Observatory of Long-Term Care, and this is the first one of the interest group in long-term care policy. I'm going to share some slides just so you know a bit more about the observatory. Some of you have seen this before, so apologies, but we're trying to make sure everybody has this understanding. So on the observatory, this is an initiative of the International Long-Term Care Policy Network. I'm Adelina Comas Herrera, by the way, and the director of the observatory. And the idea behind this observatory is to harness the collaboration that many of us had during the COVID pandemic through LTC COVID and now focus on tackling broader and wider long-term care challenges. So this aims to be a platform for cross-national learning to improve and strengthen care systems. And the idea is to identify key shared challenges, showcase how different countries and territories, localities are addressing them, to share research evidence and learning and facilitate collaborations. And this is very much aimed for anyone who's interested in long-term care, although I think the majority of us are academics, but there are also a few people involved in policy, and hopefully more people from industry, advocacy, care professionals will be joining us too. This is a new initiative. We will actually be launching it in September at the ILPN conference in Bilbao. But for now, we're beginning to try out the ideas, and I think we're beginning to have some very interesting interest groups and collaborations. So if you're new, how do you engage? Well, first of all, this is the web address, is goltc.org, which is the acronym for Global Observatory of Long-Term Care. And within there, you will find that everything is organized around topics, tools and methods, and then geography, so countries. And you can find different parts of the website, but perhaps the most dynamic and interesting at the moment are the interest groups, and this is how we're basically operating at the moment. But we're also gradually building a bibliography of publications. We're building some tool guides. We have a very good one coming soon on, for example, one of the quasi-experimental methods that we'll be sharing soon. And we have a news section as well, where we can share news of any events, any new publications that you'd like to share more widely. We have now quite a few interest groups. We have some new ones since our last webinar. We now have one on care and social protection in Southern Africa, and I think another new one is on migration, mobility, and care workers and pain in care homes. So it's worth keeping an eye because there's new ones emerging. And if you want to be part of the observatory, there's one thing you need to do, which is to register as an expert. And for that, you will find there's a button on the experts directory called Add Your Profile. And that's the way that you become a member of the observatory. It is free. And if you don't want to become a member, but you just want to receive the newsletter, there's also that option on the front page of the website. In terms of our next events, we have a very exciting one next on the 7th of March on the economics of long-term care. And there will be a reflection and a bit of a theoretical look at how long-term care features as a market and how it compares to healthcare. The speakers are Elizabeth Lemon and David Bell, and this is the first webinar of the interest group on the economics of long-term care. And then we have another one from the data science group, Beyond Words, Can ChatGPT Ease the Care Documentation Burden? So as you can see, very different topics, and I think all really, really exciting. And we have a few more listed that are being advertised on the website. 19th of March, we'll hear from David Grabowski from Harvard University. We've got one that we're about to advertise very soon also from the Employment, Education and Family Cares Interest Group. We'll have the next one on long-term care policy, looking at Taiwan, Singapore, and Hong Kong, and quite a few more. So keep an eye, and you'll see there'll be fantastic webinars coming through. I'd like to remind you all that we can also, many of us perhaps meet in person at the International Long-Term Care Policy Conference in Bilbao this September. the call for abstracts is open, and those of you involved in interest groups can always put together a session and submit your abstracts together. And I'm going to hand over to Wei. And do you want to talk a little bit about the long-term care policy interest group?
Yeah, of course. Can everyone hear me all right?
Yes.
Yes, all right. Okay. Thank you, Adelina, for this quite comprehensive introduction of the observatory. So I am going to introduce a little bit about the long-term care policy interest group on behalf of the steering group. So the steering group at the moment consists of myself, Wei Yang. I'm an associate professor from King's College London, and we also have Johanna from University of Bremen, and also Adelina. So three of us in the steering group of this long-term care policy interest group. So the long-term care policy interest group basically focuses on sharing developments on long-term care policy in different countries and different localities, and develop long-term care system profiles, and also share papers and resources on long-term care policy analysis. So for the first webinar, we will introduce a few countries, their long-term care policy system and new developments in these countries. So the countries that will be covered in the first webinar will be China, France, Japan, and Sweden. We will be hearing from 4 different speakers. Each of them have expertise in their own country or region. So we have Dr. Chen Shi from Lingnan University from Hong Kong, who will be introducing long-term care system in China.
Okay, thank you. Good morning or good evening. I'm Chen Shi. I'm a research assistant professor based at the Institute of Policy Studies and the School of Graduate Studies from Lingnan University. So I'm currently based in Hong Kong. Today, my presentation will focus on some recent development in long-term care policy from mainland China. And also, I'm very honored to be the first presenter for this long-term care policy interest group webinar. First of all, some background information regarding the population aging in China. So we know that China has the world's largest population of older adults. By the end of 2022, there are over 280 million people who are aged 60 and above. And if we take the age threshold of the age 65 and above, there are still over more than 200 million people. And also that the aging process in mainland China is very rapid. The proportion of the older adults who aged 65 and above in China increased from 7% to 14%. Just took a span of 23 years. Well, this figure, well, actually for France is around over 15 years. Well, for US, it's 69 years. For UK, it's 45 years. So we can see that the aging process in mainland China is very rapid. And also, we can see the figures on the right side. In the next decade, between the year 2010 and between the year 2020 and 2030, the proportion of the population aged 65 and above will still increase, from 70% to 26%. So we can expect that we are still facing a very rapid aging process in the next decade. And then I would like to give you an overview of this long-term care system in mainland China. First of all, I want to show you that the long-term care service are actually provided by families and unpaid carers in mainland China. So we are quite dependent on the family support system. For the public system, normally it's the person with some poverties can be subsidized with the long-term care services. So it's kind of a mean test system. It's designed for the 3 nodes. So who are the 3 nodes? They are the people who has no ability to work, no income, and no families. And at the same time, due to the demographic and social changes in recent years, we can expect that the family support system in mainland China is kind of eroding. Government also noticed that. So since 2000, the Chinese government started to take some actions and measures to respond these issues. So they proposed that we should establish a more comprehensive supporting system. Well, initially, the government they put more resources to kind of encourage the rapid development of institutional care. So they set some policy targets and policy goals to increasing the number of the residential care beds. Here is the statistics. Is that in the 2022, in mainland China, there are already around 8.29 million beds available for the older adults. Well, at the same time, since 2016, China's government kind of changed some directions. They redirect financial resources from the residential care to community-based home care. So from then on, we can see more resources were allocated to the home and community-based care. Well, today's presentation focuses on a recent development. So I would like to introduce the long-term care insurance pilot in mainland China. It was introduced initially in 2016. Initially, it was regulated by the Ministry of Human Resources and Social Security. And it was pilot in 15 cities across regions. This is a national level policy pilot. Okay. Well, in the first pilot plan, these 15 cities, they were mostly from the coastal cities. It means that they are more kind of developed cities. And also in this national policy design, it mentioned that the local government, they are granted with a significant degree of autonomy. It means that the local government, they can decide the specific policy designs in this insurance. And until 2022, this pilot scheme has been expanded. And also it shifted the management from the previous, the Human Resources and Social Security Ministry to the Healthcare Security Administration. And also 14 cities or districts were chosen in this expanded scheme. For this time, those cities or districts, they are more hinterland. And so far we can see that almost in each provincial unit, there is one pilot scheme. So now I would like to mention some findings from a quick comparison of these different pilot schemes. So as I mentioned that the local authority, they have the rights to design the specific regulations in these pilot schemes. Regarding the eligibility, normally those long-term care insurance pilot recipients, they are the recipients of healthcare insurance. The public health insurance system. So China's welfare system is an insurance-based welfare system. Well, under this healthcare insurance system, there are two parallel insurance schemes. So one is designed for employees. The other is for the self-employees or the people from rural areas. Normally, we say it's designed for residents. So some long-term care pilot schemes in some regions, they covered employees, while some of the pilot schemes, they cover both employees and residents. Regarding the criteria for this long-term care insurance, the needs assessment schemes are quite varies in different regions. Some regions, they considered assessment for cognitive impairment, while some regions, they only cover the people with physical impairment. And also most regions, they covered, well, not only for older adults, but they cover all age adults. Only one city, they focus on older adults alone. Regarding the benefits, well, initially, most of the pilot schemes, they allocate more resources for institutional care, or they only covered institutional care. But more recently, more and more regions, they started to focus on the community-based care. But still, more resources were allocated for the institutional care because the recipients, they can have higher level of the benefits. The payment, normally there is a reimbursement rate for this long-term care cost. But some regions, they set a specific amount as an upper limit. For the benefits, normally the benefits in kind, it means that they provide services for long-term care services for these eligible recipients. But it's the scope of the service quite vary from different regions. Only one city so far, they specify that they can provide cash benefits for the community-based care, or they can provide cash benefits for the informal caregivers. So as mentioned that this long-term care insurance is quite relevant to current healthcare insurance system. So the key resources for this long-term care palette is the surplus from local healthcare insurance. And also in some regions, the local government require extra contributions from employees or residents, while some regions, they require extra contributions from employers only. And also some regions, they use some tax transfers or welfare lottery funds. Okay, some obstacles witnessed so far regarding the finance. Since all the resources quite rely on the transfers from healthcare insurance fund, so it's quite difficult for this long-term care insurance to open up new channels for more resources because so far the contribution rate of all the social insurance schemes are quite high. The employees and employers, they both feel quite burdened for this insurance contribution. So it's quite difficult for them to contribution more. So far, it's still far from independent schemes. And also for most regions, the more focus on the employees because they are quite connected with the healthcare insurance for employees. In that perspective, it's quite unfair for the residents. So we can consider two options ahead. One is to widen the head count, so we can make it more wider for more residents. On the other hand, we could consider to focus on the depth. It means that we can improve the benefits level. And also some obstacles for the service part. As I mentioned that these pilot schemes, they are quite focused on the institutional care. As an insurance scheme, so the systematic systems like institutional care is quite favored because it's easy to manage. And also it's quite efficient and standardized. So those are the good reasons why they more prefer the institutional care. However, we know that the aging in place is the most older adults' wishes. And also aging in place is the trend of the global adopted by most countries. So there's something we need to consider more, perhaps allocate more resources for the home care and community care. And also the home care, as I mentioned, that lower resources were allocated for the home care. So the current benefit level is lower than the residential care. And most regions, they cannot provide cash benefits for the family caregivers. So for those people, it's kind of unfair. And also more supports and services for family caregivers are urgently needed. So this is my sharing for today. So any comments or questions are welcomed. Thank you.
Thank you so much for Chen Shi for this really excellent presentation on the long-term care system in China, especially your discussion on the long-term care insurance and the eligibility rules and finance. I think it really gives a lot of insight of the new development of long-term care insurance with inside China's long-term care sector. Adelina, shall we leave the questions to the end or?
Yes, yes, I think it will be better to make sure we have time for everything.
Yeah. All right. So let's welcome the next speaker, Camilla Ong from Nonfield Trust, who will talk about the long-term care system in France. Over to you, Camilla.
Thank you. So hi everyone, I'm Camille Ung. I work at the Nuffield Trust, which is based in the UK. But today I'm going to be talking to you about the long-term care system in France, following some work that I did with Adelina actually and some colleagues across CPEC, looking at the impact of COVID on a number of systems. France was one of those. So France's long-term care system is characterized by a separation historically between policy for older people and policy for working age disabled people. And there's variations in terms of the eligibility criteria and the funding models that support those. I'll be focusing mostly on older people today, and their main policy for older people is a cash for care scheme, and this is allocated to people who are over 60 and have care needs above a defined threshold. So as Cheng was illustrating with China, it's a similar means tested and needs tested policy. And in 2015, there are about 1.25 million beneficiaries, and that kind of number is projected to grow quite significantly. In terms of governance, it's devolved to a local authority level. So local authorities have a primary responsibility for long-term care policy, but there is a little bit of a complicated arrangement in that regional health agencies manage the health aspects of care. So that might be nursing homes, that might be nursing for people living at home, and this creates this kind of fragmented governance, which the French reforms have kind of sought to address, and I'll come to those in a moment. In terms of the provider sector, I think it's fair to say that care in France is very institutionalized. So a large number of people, 10% of people who are aged over 75, live in a residential and nursing care facility. And of those residential care facilities, about 50% are public, 31 are not-for-profit, and 24 are for-profit. And those of you who might be well versed in the English system will recognize that looks quite different here in terms of the spread of how ownership looks like. And I think this very high number of people who have been living in long-term care facilities has been something to really think about for France going forwards, because as has kind of the policy trend for more people have wanted to live at home, I think it's been a bit of a challenge in terms of how they ensure that domiciliary care, home care is given sufficient prominence as well. The workforce, so in terms of the workforce, the sector employed 1.9 million people in 2018, which is approximately 7.6% of France's whole total workforce. The majority of those are concentrated in long-term care facilities, and a much smaller number work in home care and home nursing care. So there are a number of challenges which have faced the French long-term care system in recent years. So first of all, France has been grappling with how to reform its system for about 20 years. There have been a number of policy initiatives which have become incomplete, largely due to the challenges around how to finance the system and where the balance of responsibility between the individual and the state should fall. And those kind of conversations have been ongoing, and especially as other priorities have happened. So in the lead up to COVID, there was the Yellow Jackets movement, which you might be familiar with, which kind of created competing policy challenges and have kind of delayed, again, long-term care reform in France. For individuals, I think it's a very confusing system. There's very complex finances arrangements, and it means that there's difficulties in access. So unclear governance between local authorities and regional health agencies, and high levels of out-of-pocket payments for people as well. In the recent years as well, there have been very well evidenced workforce issues. So people have suffered low satisfaction, poor working conditions and pay. I think the sickness levels of staff working in long-term care in France are some of the highest of OECD countries. And that's had a massive knock-on effect on providers. So with high levels of vacancies and instabilities due to kind of an inability to stabilize that workforce. And so providers of care have been under strain. As I said, there's a large number of people living in residential and nursing homes, and the infrastructure has been quite outdated with limited drivers of quality and improvement. So the number of people living in homes, for instance, that don't have ensuite facilities or modernized infrastructure is quite high. So COVID's kind of acted as a watershed really in terms of reform, and it did accelerate some of the aspects of reform that had been in discussion for a long time. So following a sector-wide consultation in 2020, a number of different reforms around long-term care were implemented. The first being around the workforce. So there's quite a significant flagship kind of programme of reforms around improving pay for staff across health and social care. So in domiciliary care, they increased the pay bands from 13 to 15% based on experience, and I'll return to this in a moment. In care homes, sorry, there was an additional €183 a month for care home staff, and they also increased the number of training places for nursing and home nursing. And the intention was to improve the attractiveness of careers in care. To stabilise the sector and drive innovation, the French government introduced the minimum tariff rate of €22 per hour, which is now €23 per hour due to inflation, with the potential to increase this to €25 per hour for demonstrated improvements. And again, I'll come back to this in a bit more detail. There's been a lot of investment into modernising the infrastructure for care, so quite a significant amount over the next 5 years to transform also models of care homes and make them more integrated within their communities, potentially also as hubs for other services as well, and modernising that estate, including with the development of better IT infrastructure and better digital health and care records. And then finally, something which I think is really quite substantial is the introduction of social care, long-term care, as the 5th branch of social security of the welfare state. So alongside really healthcare, alongside pensions, kind of really giving that symbolic importance to long-term care alongside other pillars of social security. That's not to say, however, that a lot of the questions around governance, a lot of the questions around long-term funding and of the responsibilities between individual estate have been addressed, but I think it does kind of give that symbolic importance to long-term care and the importance of the growing number of people who will rely on long-term care at some point in their lives. So I thought I'd go into a little bit more detail around some of the reforms that have been implemented. So in particular, there's been a lot of interest in strengthening the domiciliary or home care sector. So firstly, the government more recently has brought in policies to give a bit of certainty around funding. So firstly, there's been a commitment to spending €1 billion per year on domiciliary care by 2025. There's also been, as I said, this introduction of a minimum hourly fee for care. So the intention is to give providers some level of certainty about how much they'll be paid, create some consistency around this, and also have levers to drive improvement by allowing providers to benefit from an additional €3 per hour if they can demonstrate quality improvement, so specialist needs provision at home, extended hours on the weekend, provision in out-of-reach areas, support for unpaid carers, improving terms and conditions for staff, and actions to prevent loneliness. So there's this kind of incentive to get providers to improve the services that they're delivering. There's also been a lot of work to improve the join-up of domiciliary care services. So the different types of services have been reconfigured to increase home nursing as the kind of main way of delivering care at home and integrating services better, so that if you are someone who lives at home and has care needs, nursing needs, and a mix of all of those things, those are better joined up. And so following a number of different pilots, this has kind of become the main policy implemented last year and kind of being developed over the next few years as well. And also, I think, as part of this symbolic importance that's given to long-term care, the first National Day of Domiciliary Care Work was introduced last year, and this was both to improve the visibility of the sector and also improve the attractiveness of roles within domiciliary or home care. And then secondly, I thought I'd focus on workforce reforms. I think a lot of countries that are in similar situations to France, England, for instance, have really experienced challenges with recruiting and retaining their workforce. And I think the workforce has traditionally been kind of under-recognised. So there's been a lot of work done, as I said, to improve that. So the reforms that I discussed earlier on that were introduced in summer 2020 were initially quite positive. They were really well received in terms of recognising and giving that value to people who work in care. But one of the biggest challenges was that the salary increases were not rolled out consistently across the sector. So they were promised for all health and social care staff or long-term care staff, but they were first prioritised for people working in hospitals, so specifically emergency care staff, then to the wider health sector, and then only finally to public residential and nursing care. And so this kind of delay from the salary increases being announced in 2020 to people working in long-term care across kind of residential nursing, home care in public and private facilities took 2 to 3 years after that. And there was a lot of negotiation that had to happen across the sector to secure these increases. And what this meant was that actually there was a knock-on effect for people working in domiciliary care in particular. So lots of people have left the sector because they felt undervalued compared to counterparts working in health services. So I think it really highlights the importance of making sure that pay increases and measures to support the workforce are considered along other things as well. So improving terms and conditions, improving things like working hours, 0 hours contracts, moving away from those sorts of things. So more recently, the French government has also done some work to improve those terms and conditions. So a new updated classification of the roles and responsibilities for staff has been developed, and kind of with the intention of building a bit more of a career pathway that recognises people's experience as well as people's skills, and the pay and progression has kind of been mapped onto that. And so the idea is to have this more consistency of what you might expect if you take a career in long-term care, and also a level of career progression that I think wasn't necessarily formalised before. And alongside that, last year a workforce plan was published around ageing and independence. I'll stop there in terms of the reforms, but I think it's worth noting that a lot of these reforms are quite in their infancy. There's still lots of teething problems, and some of the most fundamental challenges of the sector have not been addressed. So the stability of funding, what the agreement is, really the collective agreement between the state and the individual, is still not very clear. So lots of improvements, but quite piecemeal, and so we'll have to kind of see how these progress in following years. But thank you.
Thank you so much, Camille, for this really comprehensive introduction of the long-term care system in France, and you outlined, the overall system and the aging population. Then you talk about the challenges the systems encountered, and then also you talk about recent reforms that government had initiated. I'm quite sort of impressed by the kind of reform the government is initiating in terms of the workforce, the pay, the increase of the pay, and also improving the working conditions and the working hours, which I think is probably an under-addressed area in many countries in the long-term care system. All right, so let's maybe move on to our next speaker, who is from Japan, Ruru Ping. So Ruru Ping is from Hitotsubashi University in Japan, and she will talk about the long-term care system in Japan. Over to you, Ruru. Thank you.
Great, thank you, Wei, for your introduction. And it's my thank you. I'm Ruru Ping. I'm from Hitotsubashi University in Tokyo, Japan. It's my great privilege to introduce the recent development in long-term care policy in Japan. So as everyone knows that Japan has a mandatory national long-term care insurance system established in 2000. One of the major motivation is to separate the long-term care from its medical care system. As in 1980s, many older people stay living in hospitals after being discharged, and this creates a social problem. And Japan's long-term care insurance system covers older population and also working population aged between 40 to 64 years old who have certain aging-related diseases. And the system is financed through general taxation, premium, and users' co-insurance range from 10% to 30%. The municipal government, the local authority, work as the insurer. And after a very comprehensive needs assessment, the certified users are eligible to access to support and assistance from the system as the in-kind benefits. Compared to the German system, cash benefit is not allowed in Japanese system. And different from French system, Japanese long-term care system heavily relies on home and community-based care compared to residential care. And although one of the major objectives to establish such a long-term care insurance system in Japan was to shift the care responsibility from family to the society, until now, the informal family caregiving still plays a significant role. Just for your information, we already provide a comprehensive long-term care system profile in Japan on the platform for your for information for further details of the system. In these years, Japan still facing two overarching challenges. One is as the population continues to age, we experience rising burden of chronic non-communicable disease. This leads to a need for a more integrated care system. And another specific social problem that attracts recent policy attention is the increased demand for the use of ambulance services in urgent conditions. And this generates unnecessary cost in emergency care. And recently, government put some effort to integrate social care and the medical care system. And similar to many other countries like France and the UK, Japan also experienced chronic shortage in care workforce. One problem is there's a significant widely gap in average salary between care workers and the national average salary of all industries. And although the government put some effort to narrow this gap, but the gap is still significant. In response to these challenges, Japanese government took some initiative to address these problems in these years. In 2015, to address the demographical and epidemiological transition, the central government announced to establish a community-based integrated care system. This take into account of both community-based care concept and integrated care concept. The fundamental principle is to respect the autonomy and ownership of community and empower the community to mobilize the community resource so that can enable older adults to age in place. The plan to establish such a system is under the guidance of municipal government and discussed with all the relevant stakeholders of the community. And this is regularly revised while developing planning and implementing the plans. So this is there's a feedback loop of iterating of the plans. The integrated care system aims to integrate medical care, long-term care, preventive care, daily living support, and housing services under the support of not only government support, but self-support, mutual support, and the community solidarity support. As I previously mentioned that the initial objective to establish a nationwide long-term care insurance system is to separate social care from medical care. But in these years, the central government puts tremendous effort to integrate medical care and social care so that the system can provide seamless care for the older patient from acute stage to post-acute recovery, rehabilitation, and maintenance stage between hospital and the community, so that unnecessary use of ambulance service and the emergency care service can be avoided. This requires not only coordination and collaboration between the two sectors across the relevant stakeholders and organizations, but also require data sharing. In 2021, the Cabinet Office enacted an amendment to the Long-Term Care Insurance Act to committed developing data infrastructure to be able to share data information between medical care system and social care system. In these years, like France, Japan also puts tremendous efforts to recruit and retain qualified care workers. Just read in the end of last year, the Cabinet Office approved a special budget to give every care worker an additional 6,000 yen effective from this month to prevent further dropout of qualified care workers from this industry. But despite in recent year regular revision of their pay and this additional 6,000 yen effective from this month, many care workers consider those are not sufficient. And the gap between the national average and care sector remains very wide. And many industry groups ask government to increase official nursing care fee. In Japan, we have national fee schedules, but it's difficult for Japanese government to implement it because the government experiencing serious financial fiscal burden. And one policy option is to increase premium, but this is gonna generate another controversy. In the meantime, Japan further opens its labor market to international care workers by establishing bilateral agreements with other countries for formal training programs. But the retention rate is very low, especially when Japanese yen becomes relatively weak in these years and make this labor market less attractive to many international workers in general. Japan also promotes the application of new technologies in nursing care sectors to complement some tasks conducted by human staff. On the other hand, Japan is very cautious in new technology adoption and put some certain tasks subject to very stringent regulations, such as overnight monitoring. So in brief, we haven't come up with an effective long-term strategy in addressing workforce shortage, but we are trying to put a variety of policy initiatives and trying to address the pricing challenges. So those are the situation in Japan. Thank you so much.
Thank you so much, Ruru, for the introduction of Japan's long-term care system. And we always think that Japan has one of the most established and advanced long-term care system, but you also have lots of problems from what you have discussed. But we have heard something which is quite inspiring, maybe for other countries, such as to have a more established data infrastructure to allow integrated care between the healthcare sector and the long-term care sector. So these are the initiatives that other countries can perhaps learn from, and also the adoption of technology and development, which I think would be a really interesting area, and we can perhaps in the future webinar or future research we can share more about this area, what Japan has been doing. I know that Japan has a very big market for using technologies and in their aging sector or long-term care sector. Okay, maybe we can turn to our last speaker, Dr. Lennart Johansson from Jönköping University from Sweden. So he is going to introduce the recent long-term care policy developments in Sweden. Over to you. Thank you.
Thank you. Thank you for inviting me. I'm at the School of Health and Welfare in Jönköping, Sweden. Next slide. This slide shows the three-tier system of governance that we have in Sweden. It was enacted in 1992 when the community care reform came in place. At the left column, you see the national government is responsible for policy, economic incentives, legislation, and supervision. And in the end, you find that national government's share of funding for long-term care in Sweden is some 5 to 10%. The second column shows the responsibilities for the 21 regions that we have in Sweden. They are responsible for hospital care and outpatient care. And then the third column to the right, you see the responsibility for the 290 municipalities. First, they are financially responsible for bed blockers in hospitals that are medical treated and ready for discharge. The core of the help, the municipality, the long-term care help in Sweden is home health care, but there is also a number of other types of services as assisted devices, welfare technologies, daycare, and short-term institutional care. And the municipalities are since 1992 responsible for all types of institutional care, including nursing homes, group homes, and residential care and assisted living. And in the end, you see that the municipalities are the major financing long-term care services in Sweden. It's about 85 to 90%. Some 4 to 6% are financed by the user's fee. So you could summarize by saying that long-term care in Sweden is financed, driven and provided by the 290 municipalities. And at the same time, this means that we actually have 290 different types of long-term care system in Sweden. Next, please. This slide shows the development of service provision since the beginning of the 1990s up to this date. There has been a rather extensive reduction in service provision in Sweden since the beginning of the 90s because due to aging in place policy, but also extensive containment measures that has reduced the level of provision of services. This shows the provision of service in terms of coverage ratio for persons 80 years and older from 1993 to 2022. And as you can see, the blue curve illustrates how institutional care has been reduced from 1993 to 2022 from 24% to 17% something. And that is a relative reduction with 1/3. And if you look at the red curve, that is home help. Home help has also dropped from some 22% in 93 to 10% of those 80 years and older in 2022. And that is a reduction with over 50% since the beginning of the 90s. And if you collapse these, the total coverage ratio, institutional care, home help services provided to persons 80 years and older has decreased from some 46% to 27% over these years. And that altogether is a reduction with some 40%. So this is the development during the recent 3 decades. Next, please. There is a number of current challenges in Sweden. Next. First, to secure and develop service level and quality in health and social care for all the people, and to contain costs and increase cost efficiency. And of course, that maybe the major problem is to recruit and retain qualified care personnel. Next, please. There are a number of strategies that the municipalities are trying to adopt. First, to promote independent living, healthy aging, and self-care. There is a lot of programs, preventive home visits, health check-up programs, free reviews of drugs, vaccination, and fall prevention programs, and physical exercise programs, mostly run by the municipalities, but also by voluntary organizations. The uses of welfare technologies are increasing in Sweden. Safety alarms with a GPS function, passive alarms with sensors, web camera monitoring at night and daytime, and robots, so-called medication reminders, are widely used. And another strategy is to increase the coordination and collaboration between health and social care. And it's very much centered around mobile teams, either starting from the hospital or from primary health care centers or in the municipality. Telemonitoring is becoming more and more used in long-term care. And there is so-called safe return programs that you find in most municipalities, helping people to have a secure trip back after being discharged from the hospital. And there are a number of care work promotion initiatives, care time budgets, division of tasks and competence, and e-rostering and electronic keys. So of course, in many municipalities, they try to use these different approaches and strategies simultaneously. Then it is another thing whether they will be successful. And as I said before, it's very difficult to discuss and give an accurate picture of the situation in long-term care in the municipalities in Sweden, as there are so great varieties in service level, in the access of care personnel, and in the end of how much services that are provided to all the people. I stop there. Thank you.
Thank you so much, Lennas, for the presentation on Sweden. From what we have heard, I think the problem that Sweden have encountered more or less quite similar to what we have heard from Japan and then also France. We have an aging population, but also we can see the government has trying to think of strategies to reduce the financial burdens on them, and to encourage the use of technology, to encourage independent living for the old people, and then also the problems of the care workforce has been a problem almost in all the countries that we have discussed it today. So I think I'll open the discussion to the floor. There are quite a few questions on the chat. So Johanna, do you want to monitor the last session?
Yeah. Yes, I can take over. Thank you. Wait, so I think there are still 2 open questions from the chat. I think some have been already answered. Thank you very much for that. So one short question we still have open from the chat is from Nereide Alhena Kureri, and it's on Japan for Wuwu. How big, small is the community in the community-based integrated care approach is what she asked. Can you quickly answer that maybe?
Yes. The quick answer is it depends. It purely depends on the local issues and local resource assessed by the municipal government and relevant stakeholders. So at the operational level, it's important. The important office is called Community-Based Integrated Support Center, which is established by the municipal government, namely the local authority in Japan. And give you some flavor about the distribution. Is in Japan there are about 3,200 municipal government, and as of 2020 there are already 5,200 local communities. So it's still developing and depends on the local issues and resources considered by the local authorities. Hope this answers your question.
Thank you very much. And before I come to Kathleen, there's one more open question in the chat, I think, which was for, it's just been answered. Okay, so we can turn to the, we can turn to persons raising their hand. So Kathleen Needham, please.
Thank you, and thanks for a really fantastic set of presentations. That's so useful, and I'm really looking forward to the future presentations in this series. And I guess my question is probably not the one that will get answered within 2 minutes, so maybe it's more of a suggestion for a future event, which is, I suppose, how much these countries are learning from each other and how much sort of policy transfer, policy borrowing there is, whether there's some countries that are really kind of seen as the leaders and that other countries are learning from, because I guess my guess is these countries, and everybody is reforming, and I'm guessing they're probably not doing it completely in isolation without looking up. I might be wrong there, but I wonder whether, yeah, we could return at some point to the question of how much learning there is going on and who's learning from who.
Okay, yeah, I think that's maybe too big for it now, but it's a very interesting or important point. So do we have any more specific questions that we can finish in 1 more minute? Otherwise, we would come to an end, I think. Okay. Well, that's great because we are almost up on time anyway. So, Adelina, do you want to conclude?
Yeah, so thank you very much. Fantastic presentations and great to see the question and answers happening in the chat. And thanks we had now a couple of suggestions on topics and questions for which future webinars. We're very happy to hear from you if you'd like to present, particularly if you have been working on workforce, on how countries are learning from each other. So please don't be shy about suggesting yourselves for webinars. Long-term care policy is a very wide project. We also envision that there may be some splinter groups that will be more focused on particular topics, and we're very happy to have suggestions to lead some of these more focused groups that may be able to go in depth into some of the topics. And for now, we'll be continuing with an overview. The next one from this group will be looking at 3 smaller Asian countries. We'll look at Taiwan, look at Hong Kong and Singapore. And the following, well, and then we'll let you know about the following one, but we plan to also visit Latin America and the Caribbean, and also hear from some of the work of the World Health Organization in Europe. So thank you very much for joining us.